said go ahead. But anyway, we'll get started. Yeah, so welcome back. My name is Dr. Reinhardt, and we're just going to get started. We do these workshops from time to time, and attendance ebbs and flows. We've had one, we've had a house packed, so we're glad you guys made it, and we're going to go on and carry on. Anyways, as far as kids go, they are free to roam, whatever. Don't worry about if they're making noise. We want you to catch as much of the content as you can, but we understand it's a family-friendly event, and we're prepared for whatever. So I'm going to present the first part, and then Kirsten's going to step in, and she's going to talk about movement and weaning from a swaddle. There's some important changes that have just happened recently, and she'll update you on that. But really kind of a transition period that all parents go through when you have them swaddled, and then they're not, and blankets, and what's safe, what's not, what's good for them. So she'll talk about that, and then I'll close and wrap up, and any questions along the way, feel free to ask. So, all right, so it's called Raising Healthy Kids. This is one of our workshops. We'll actually do this one periodically. The other one that we'll do is called The Perfect Storm. That's that little poster with the little tornado-looking icon on the wall there. That one is about the kind of this environment and the certain things that often are setting up the stage for childhood challenges like ADD, ADHD, autism, learning difficulties, chronic illnesses, all of those things. So some families find themselves already in crisis mode, and we're trying to break them out of it. This Raising Healthy Kids is trying to take the kids that aren't quite there yet and keep them out of that. So, maybe we're just using antibiotics occasionally, but we don't want to use them at all. We're looking for some just ways to raise healthy kids. So that's what the focus of this workshop is about. I'm gonna keep it simple. The seven steps to raising healthy, happy kids. So first step 0, is choose your guide. There's 3 traditional approaches that people will take, and those are to pediatric, prenatal, and family health care. So the first one, the traditional one, is going to be the traditional medical approach. So that's your medical doctor, your physician's assistant, the Western medicine that most people are using in the United States. The traditional paradigm there is they're using symptoms to make a diagnosis, and the diagnosis, rather than the treatment, is pretty much just get the symptoms to go away. And that's sometimes needed. When we're in crisis care, we need to there's bleeding, that's the symptom. We need to stop the symptom, because if not, we're going to lose a life, right? But that's not really a system that's set up for preventative health, as well as some of the other options that we'll have here too. But it's good to have one of each of these 3 guides. So the second one is a natural/nutritional, so functional integrative. So that's like a naturopath, acupuncture, lactation consultant, massage therapist, like all these other, if you want some additional guidance as far as that goes. And then the third one we're talking about is what we do here in this office is some sort of a chiropractor, but ideally a subluxation, neurologically focused chiropractor. So everybody has differing familiarity or experience with chiropractic. And what we do is very different in that we say it's neurological and subluxation centered. But just out of curiosity, have either of you had experience with chiropractor at all? Okay. So you've seen it, yeah. So the traditional approach is they're going to be looking at the bones on your spine. So like your back bones, you have your spinal cord that runs through them. And so if the bones get out of position or the joints get degenerated, it can pinch and interfere with the signals your brain sends down the spinal cord. That's basic chiropractic. Traditional chiropractic will find like little misalignments in those bones, and then with their hand try to nudge and realign the bones. What we do is we'll actually just look at neurological reflexes, and I just use a gentle vibration or a pressure point just to get the nerves to reconnect. And my goal is to train your brain to send better signals to your muscles, so then the muscles realign. So it works really well with children. It doesn't take like the traditional you maybe a lot of people are like, no way, you're not doing that to my kid. When kids are adjusted, even with their hands, it's like the pressure you put on your eyeball. It's not like what you see on YouTube, and some of that stuff is crazy to begin with. But we have a very gentle neurological approach. So the whole idea is connecting the brain to the body, because that's the brain's job. The brain runs the body, and when we get overwhelmed and stressed, the brain gets disconnected and it's not able to do that as well. And that's where we see a lot of diseases, allergies, problems coming from. So the core 4, big picture overview. So that's what I was talking about. The nervous system, the picture of the brain there, that's the boss. Make sure it's functioning at full potential and power at all times, because it runs the whole body. And that's the job of a chiropractor. Check and see how the brain is communicating with the body. If there's any subluxation or interference, we call it, try to help the brain reconnect. and then good things happen because baby will poop better, baby will sleep better, kids will digest better, get sick less often. All that is the exact same for adults too. So that's what we're finding there in the first point. And movement is life for babies, kids, all of us. So I use the saying in the office: you don't use it, you lose it, and that's true of any like language skill, riding a bike. That comes back pretty quick usually, but like range of motion. As we get older, if you don't use your ability to bend all the way this way and bend all the way this way, or check your blind spot, as you age, it goes this and then this and then this and this, and you lose that range of motion. Now, that's a problem from the standpoint of being able to do life, play sports, pick up kids, check your blind spot, but also your spinal cord lives inside of those bones. And if all of a sudden that degeneration or that restriction in motion isn't allowing the brain to fully signal, that becomes a very serious issue. So we're always thinking about, yes, the spine is like the house for your brain, but really we're wanting to take care of the brain and spinal cord on the inside. And that's our main focus. So sleep is everything. You can't get too much. I mean, really, you just stop sleeping once you've had enough. I mean, like that's huge. Way more of a problem of not getting enough sleep than getting too much. Ideally, we would not use alarm clocks. We would not even use much for artificial light. I mean, like you look at native peoples, like they go to bed when it gets dark and they get up when the sun comes up. They sleep a lot more in the winter months because it's darker more, and in the summer they're up more, and they just follow the seasons. And that's how we're wired. That's how we're built. We're not exactly built to go stare at a screen late into the night, have an alarm clock wake us up, so that creates some challenges. But once again, we can adapt to it. We can make it work. It's not that you're saying you can't do that. But for kids, it's really great if you just let them sleep. They're growing. They're doing so much. Sleep alone can just cut down how often you get illnesses in your family if you're getting enough sleep. So like, well, first off, getting the brain balanced and adjusted, getting them to eat well, latch well, that's a huge part of it. Room darkening shades or blackout shades. So that helps, when you're trying to get them, just create a dark environment for them to sleep in. So things like that can be really helpful as well. And then live clean. Kids and chemicals don't mix. They don't mix well, right? And by chemicals, it's way more than what you think of. I mean, there are more and more chemicals, even in like our carpet, in the building materials, in our shampoo, deodorant, like just what's in our just like Tide laundry detergent, dishwasher detergent. All of that stuff is getting more and more toxic. And so we always recommend to look for some sort of a greener or natural approach. There's some really great companies that offer really great products for that. And it doesn't have to be really any more expensive too, when you navigate how to find it. But every little bit counts. And there's not only a danger from kids getting into it, like your cleaning supplies in the bathroom, right? If they get into the bleach and the Clorox, and like that is extremely toxic. You wouldn't want them to get in the natural version either. But if you have just that natural product in your house, it's less of a risk from that standpoint. But then there's just fumes and traces of it all over. Like one of the ladies from Melaleuca is a brand that we were looking into, and sort of a natural healthcare store. She was pointing out how the dishwasher detergent that you use, and if you're using this the traditional kind, it's a lot of heat and a lot of gases and fumes coming out of that dishwasher just into your house. So you may think, oh, it's just on my dishes and then it rinses off and it's all down the drain and we don't really ingest it. That air and that gas and that fume is coming out into your house every time you run your dishwasher. So whatever's in that pod, which would kill you if you ate it, enough of it, that's turning into gas, and you're breathing it. So every little bit counts. And that's a lot of times we're like, allergies are worse and sleep is worse. And so all these little things count. But kids too. I mean, if they're younger, they can't handle as much as adults. And we got to be aware of that as well. So steps 1 through 3, eat, sleep, and poop. That's kind of what little ones do, and they do it over and over. And the better they do that, the healthier and happier they are, and you are as well. So going through the neurology, so C1 Atlas like the Greek god that like holds up the world, that's what that one's called. But that's the top bone in your spine. So what we're talking about here is the different vertebrae or different bones in your spine. But really what we're talking about is that section of your spinal cord, what functions it does. So I'll have a little folder for you, this on the right, which you can look at and take home, and you can kind of see which parts of your spinal cord control which body functions and how important it is to take care of those different regions. But the top is like where everything comes in and goes out of the brain. So very important to have that part of the spine well cared for. C2, the second right below it, that's where a lot of immune system, a lot of motion for the neck. So being able to turn to latch is a big part of that as far as breastfeeding or eating in general, swallowing. The vagus nerve, that's just a very hot, maybe you've heard of it, but that's like the brake pedal nerve to your whole stress response. So if your vagus nerve doesn't work well, you won't be able to calm down very well, or the little one won't be able to fall asleep very well, digest food very well. All these problems result from not being able to calm down and get into a healing response well. T6, so that's kind of like right in the middle, the chopper upper region, that's like upper digestion. So that's kind of like where the stomach and the first part of the intestine is located. So if there's problems there, that's where digestive interference can start. So maybe some of the reflux, burping, gassiness, that kind of thing. T12 is a little bit lower, called sorting and warehouse region. That's where like a lot of the nutrients are kind of assimilated and digested and absorbed at a deeper level. And then down low, that's where if that's not working right, we get constipated. And same thing for little ones. And a lot of that comes from when they start to sit up, a lot of changes happen in their spine. And so if there's pressure on those nerves, that's where constipation or just being able to potty train, all that stuff can come from if there's just not good connection down there in the bottom part of the spinal cord. So here's another thing. Step 4 is be prepared to kick the sick without medications. So a lot of this comes from preparation, right? We want to be proactive about our health rather than reactive. So set up and do things now to prevent the ear infection rather than once both ears are raging, now what do we do? Like, it's much better to be proactive. So a couple articles here. This one's saying fever is an important resource in infectious disease research. So I just always touch on that. A fever is not a bad thing. A fever is your body's way, or the little body's way, of fighting an infection. It could be a bacteria or a virus. So think of a fever as their immune system sweating, just getting a workout. So the last thing we want to do is just to medicate it and make it go away. The problem is if a little one has a fever and you give them some ibuprofen or Tylenol or whatever, it'll make the fever go away. They'll feel better, but you just put their whole fighting this bug on hold for a little bit while the bug gets worse. So you kind of just pause the whole immune response. They feel better. Oftentimes they're going to play too hard, be awake when they should be sleeping. And then when the Motrin or whatever wears off, fever spikes, and we're kind of back into that tug of war, that cycle. Now, there's a time and place. The fever's out of control, then that's a different story. But a lot of these low-grade fevers, if you can do things like get them adjusted, make sure they're hydrated, just a lukewarm bath, hold them skin to skin. I mean, that's a lot of girls. I'll sleep with them in a chair, and I'll just put their head on my chest, and I become like a radiator on your car. If you just put your child close to you, you can regulate your body heat, and so you're just going to be sucking the heat out of them like they would be if they're sitting in a bath. You just can't be in a bath all day. So that's the same thing, chest to chest or skin to skin. You're not going to make them too hot as long as you're both relatively thinly clothed. Same concept if somebody falls in, like, gets hypothermia. They're really, really cold. Best thing to do is get in a sleeping bag and warm them up, right? Because you become equalize the body temperature that way. So that's a really good thing you can do. Just a little touch on fever. The second one here is cough management, practical approach. Your cough, like a lot of us, we hate the cough, and it's annoying when it keeps the kid up at night. Or us, that's not fun. But a cough is what's preventing pneumonia a lot of times. Cough is getting the gunk out of the lungs, right? And just loosening up the mucus and all of that so that it doesn't get infected and turn into a pneumonia. So say the more we're gonna suppress a cough with a medication, the higher risk for a longer cough or possibly pneumonia. Now, and unfortunately, when you go to lay down at night, that's when you kind of cough the most. But there's just some natural things you can do, like just give them a sippy cup of water at night, some cold water or some like honey water, just different things that kind of soothe it, but not like force it to stop. And that can be helpful too, because like whenever you use a medication, you're just like shutting down the body, you're forcing the fever to stop, you're forcing the cough to stop. And that's different than just kind of supporting the body and saying, if you really need to cough, go for it, but we don't want any more coughing than necessary because nobody's sleeping. And there's a different approach there. So the last couple of quotes here: not all exposure to germs and bacteria are inherently bad. It's actually very important. Just like, basically their immune system is learning. The more dirt and stuff they get in their mouth, the stronger their immune system gets. Just like moms have great immune systems, teachers have great immune systems. They're around it all, so they get strong. The ones who have the most susceptible ones are the ones that really back away. They sanitize everything. They don't let their kids eat. Then they get hit hard because they're not as well practiced. Yes, exactly. Best immune system in the body is not in a lab, right? Dirt. honestly, and even if you do studies, like the bacteria, the nastiness on like your kitchen sink is way worse than what's on the floor. Like there's not a lot on the floor that's going to get them sick. There's some pretty goofy stuff on the kitchen sink, on like the drinking fountain, on a lot of these places that we think, oh, that's sanitized regularly. It's like the dirt on the floor is way better. Keep that in mind. Let's see, fever, overall beneficial process. Yeah. So cough is an important defense reflex. Real root cause, so interference. So interference, what I'm talking about there is when the brain gets stressed and then the brain cannot adequately communicate with the body. That becomes a major problem for healing. So if the brain is not communicating with the immune system, that could be a reason why the fever is higher than it needs to be, or it's not effective, or just anyway, it's just making everything last longer and the body's not healing as well. So when there gets to be interference, the fever gets out of balance, the cough gets out of balance, too much coughing, too little coughing, too much pooping, diarrhea, too little pooping, constipation, and then usually there becomes sort of inflammation, right? Their little buns can get raw and red, from too much pooping, or coughing. They get inflamed in their lungs, and so too much or too little isn't good. We want to just stay balanced so we can have, ideally, I'd say the biggest goal is the least symptomatic. That's kind of what we're all going for. High quality of life, so like the least symptomatic life we can, right? If we're gonna have a cold, have it be like an hour or two, not like a week or two. Have it be quick and or asymptomatic. A lot of us, we have infections all the time and we have no idea because our body handled it before we got the sinus pressure, before we got the headache or whatever we got. So that's kind of the goal. And the more we prepare ourselves, the better chance we have of not going through the symptoms, mom and dad not taking off of work, not canceling the family vacation, and just quality of life is better to begin with. So I kind of tell people, you think about it like going through life, like if you really, if you have to walk up 2 stories of stairs and you really don't want to sweat, one of the best things to do is be in really good shape. It doesn't matter how many clothes you're wearing, it won't be much of a workout for you and you probably won't sweat, right? So if you really don't want to get sick, have a strong immune system, and then you're less chance of having your immune system sweat by having a fever, by having a cough, by having all the symptoms and stuff. And then step 5, stock up on nature's medicine cabinet. So this is a little infographic zoomed in on the fruits and greens, those slushies. So that's just one of the things we have. That's a great supplement to a diet. Ideally, we're getting good fruits and vegetables and real food. I'm always promoting that more so than the just supplement everything. But a supplement comes alongside because our food is not what it used to be. Our soil is not what it used to be. There's a lot, not everybody can afford or is able to get all organic or all like high quality fruits and vegetables. You can just look at some of the stuff. You just bite into one of these huge apples and it just tastes kind of like watery and just weird. And you buy like an organic one and it just tastes different. I actually saw it. We had like a non-organic apple in our kitchen last week and we cut it in half and like left it on the counter for a couple hours and we came back and it was still white. I was like, oh wow, because like I was used to having like the organic ones, you cut them and they're brown in 20 minutes or less. So that was an eye opener to be like, that's how many preservatives are on the inside of that apple, keeping it white, not allowing it to just break down. Same thing happens when I eat it. It's harder to break down in my stomach. If air can't break it down, then my stomach's gonna have a hard time breaking it down too. But this will be one of the things we'll set you up with a little sample of these fruits and greens if you guys want to try that as a great way to get a supplement in the kids' diet. And then step 6. So this is kind of what I was talking about. Understand and prevent the perfect storm or work to reverse it if you're already in it. So the perfect storm is where things get really bad. We're looking at doing tubes for ear infections or chronic conditions, ADD, ADHD, autism, all that stuff. Like that's a crisis for that family and that child. So we want to work to prevent it or reverse it. And this is kind of the sequence. So just a really quick summary of how that happens. A lot of times it starts with fertility or pregnancy stress. So if mom has a stressful pregnancy, maybe medications are already there and the baby's exposed to it during pregnancy. Maternal intervention, labor and delivery. So if there is like a C-section, forceps, suction, a traumatic delivery, or sometimes just a normal delivery can be traumatic for the baby. And if that's not properly addressed afterwards, so if baby had a misalignment in their neck during the birth process, that can kind of set the stage for the rest of the steps here. Stressed, colicky baby with neuromotor challenges, so development a little bit late, not moving like they would, latching problems, feeding problems, things like that. That's kind of the third red flag or sign that can lead to this. stressed, constantly sick, challenging toddler with more challenged, motor developments, things like that. Then sensory spectrum, you could get all the way to a child somewhere on diagnosis mode, whether it's ADD, ADHD, autism, all those different sensory deficits and disorders. And then you become an anxious, angry, depressed teenager, an adult, and like so somewhere along this line, everybody could be falling into that perfect storm. So we're just doing whatever we can to not let any of that happen. And so that's the things to watch out for. If you can see some of those in maybe your history or your children's history, that's just a red flag because we don't want to be anywhere near any of these end results. And then burnt out, stressed out, anxious, ADHD adult would be the final step there. So Harvard developing child discussion, I'm just going to glance through this here, but basically what we're talking about here, there's Harvard research that's showing the interactions of genes and experiences shape the developing brain. So basically like nature versus nurture stuff, there's a lot to do with the nurture, how that little one is developing, what kind of environment they're in, what kind of toxins they're exposed to. So the genetics that they got are important from mom and dad, but very, very important. I'd say that's about the 10% factor. The 90% is how they're living their life, what kind of chemicals in their house they're exposed to, what kind of emotional stress, what kind of birth stress from a C-section or forceps delivery or things like that. And that makes a huge, huge difference in how the brain develops. Cognitive, emotional, and social capacities are inextricably intertwined through the life course. So all this just gets to be a component of how the little child is developing. And then toxic stress weakens the architecture of the developing brain, which can lead to lifelong problems in learning, behavior, physical, and mental health. So Harvard is showing that basically our environment is playing a role in how kids' brains develop and whether or not they're having these problems down the road. So this is encouraging to me because the focus is being taken off of just the genetics you got from your parents, and it's more in your hands is like how you live your life. It's kind of depressing just to be like, oh, I got bad genetics and I'm just going to have these problems all my life. There's nothing I can do about it. It's empowering to say, no, I'm the 90% factor of whether I smoke or don't, whether I exercise or don't, whether I sleep well or don't, whether I get adjusted or don't, like all those different things. That gives you power and your control over your life and how you live it. So this is another little infographic that we have. It's stress stuck on. So that's talking about like the vagus nerve and whether or not when you or your child gets ramped up by the trauma, toxins, and thoughts, can you calm down? So we all get ramped up at times, but can you calm back down and get back into that state where you can heal? And if not, this is where we have problems with development. So movement matters most, and that's what Kirsten's going to talk about in just a moment here. But the point is how these brains, this is like a little milestone or a neuromotor development chart, which the CDC just changed recently. Like basically enough kids aren't meeting those criteria, so they bumped everything back, which seems completely backwards. It's like maybe we should look at why they're not meeting those criteria instead of just make it easier. It's like saying if like a lot of America is overweight, let's just change the BMI for what obesity is. Like that makes no sense at all. I think most people would see that, but like this is a little bit sneakier. It's like, oh, they must have had some new research. No, like just kids are not developing like they should be, so they change the goalpost. But anyway, movement matters most. So step 7. So there's like a sequence of what we want to be watching for. So movement, gut health, immune function, speech, how they're talking, social, behavioral, and emotional. So all these different things are developing, and these little brains develop from the bottom up and forward. So kind of internal brain all the way to the front. A lot going on is the takeaway, and then we got to be watching for that. But milestones are very important, and we want to do what we can to help kids meet those milestones and have the best, healthiest life they can. All right, so I'm gonna turn over to Kirsten here.
My name is Kirsten. I am a certified lactation counselor with Oasis Lactation Services, and I will be talking about weaning from a swaddle and just the importance of movement for babies specifically. So what I'll go over is just gain an understanding why babies are swaddled, possible effects from swaddling, discuss the options for weaning, and then the importance of movement for babies. So kind of if there are any risks involved with swaddling, kind of why are families swaddling their babies? And most of it comes from beliefs from the hospital, pediatrician, friends, family, just kind of what we're advised to do. So some reasons why: possible improved sleep. We're told that babies will sleep better because it's more womb-like, it's tight, it's cozy. He agrees. And then, especially with the AAP's recommendations, the American Academy of Pediatrics recommendations for sleeping on their backs to just improve sleep and reduce the risk of SIDS, sudden infant death syndrome. So, swaddling can affect different aspects for a baby. And what we can look at, I like to use the word effect because risks is important to know, informed information to know, but also there are just other things that we look at, especially from a feeding perspective for mom and baby. So we look at infant milk intake, the way that they intake breast milk, either or formula, from breastfeeding or bottle feeding. Missing feeding cues: if they're swaddled, they're contained, they're not moving their hands, they're not being jostled around, moving on their own. So we're kind of missing those feeding cues as parents. They're just sleeping a lot or just being more contained. Muscle tone: if they're not using that movement that they have, the range of motion, we're kind of losing that muscle tone kind of all over body. There's so little that just any movement is so beneficial for them. We see it in mom's milk supply. If if we're not having that frequent milk removal that we need, then the milk supply, our body will be told that we don't need to make as much. And then gut motility is very important. Gut motility is just making sure that the gas is moving fine, baby is burping as they need, and then pooping, because babies poop tell us a lot about what's going on in their little bodies since they aren't able to tell us. And then just kind of continuing. So persistent feeding difficulties: if you're having feeding difficulties with breastfeeding or bottle feeding, difficulties meaning baby is refusing to latch on the breast or making a lot of noise on the bottle, leaking milk, all those kind of signs you look for. Just kind of not content in between feedings, if they're fussy, if they're grunting. And then kind of going off of what Dr. Samuel was talking about, nervous system dysregulation. So if they are more on the fussy side, kind of colicky, not able to calm down when they need to, can be from swaddle, and I'll go over that with kind of the next points here. Unresolved tension. So this one's important because, as we were talking about, some birth can be hard on babies as they're in the womb. Typically they're like this. Even in breech sometimes can be even more tension creating. So as they're here in the womb and then they're birthed, sometimes there is that C1 that gets out of place and they have just some tension. And for us adults, if you have any discomfort in your neck, doing anything is uncomfortable. And if you're going to drink, we always tilt our head back to drink. And if baby isn't able to do this movement because it's uncomfortable for them, we don't want to ask them to do something that's uncomfortable. Why don't we find out why it's uncomfortable and kind of how we can work with it, resolve it, and get this extension that we need. So the reason why that comes into swaddling is because I'll just loosely swaddle my baby here. So you see, my baby is not a good indicator of actual baby, but nice and neutral here. If we swaddle, we have that, this will be tight on the shoulders and the neck. So we're facilitating, we're kind of making baby go in that flexion, where if we are feeding, we need extension here. I got the microphone. We need extension here, open chest, but swaddling does the complete opposite. So if we are having baby in a swaddle for hours for the day, we're just not letting baby get that nice stretch that they need for good feeding, for good movement, for good motor development. And then the last one that I'll go over is plagiocephaly, which is the flattening of the head. And that can be, if you have noticed, I look at this stuff all day, every day. So if you've noticed, all the babies in the swaddles, their heads are turned one way. And that's just kind of what we're used to seeing. And that's not necessarily bad if they have the full range of motion in their neck. If they have tension, let's say in like the right side of their C1 or C2, then they're just stuck like this. And if they're swaddled, they can't necessarily, they don't have the ability to move their head to neutral or even the other side. So they're just stuck here. And I'll show you. So this baby turned to the left, and then this baby is just completely to the side. And this is a bassinet that swaddles baby, rocks them if they move, and they're just stuck here for hours. Great sleep could be, but not ideal for infant movement and motor development. So that's what I'll go over on this slide. So again, I look at this stuff all the time. This baby is swaddled. You will see, well, I guess I'll ask you, what do you notice anything about this baby's positioning? What do you notice? Mm-hmm. Yep. So this flexion that we're seeing, the baby's head turned to the side only, and a curve in the baby's body. So that's telling us that this baby, particularly to the left, has tension in the left side of their body. So if there are any feeding difficulties, that can be from this flexion and just dampening the nervous systems, not letting them have full expression that they need. And this is fine for short periods of time if that's what your family chooses to do. But if it's for long periods of time, many hours for the day, we're just having baby here with that tension in the side of the body. And if we're not working on that, if we're not trying to undo that tension, then it just kind of will persist. And then we just see other effects from that. So options for weaning, oh, it went backwards. So when to wean, we don't necessarily feel a need to start weaning. A lot of the hospitals will, and NICUs, if there are any NICU babies, they usually swaddle the baby because, kind of going off of one of the first slides, that it's womb-like, cozy, kind of keeps them more content, dampens that moral reflex, which is their startle reflex. And the moral reflex, I'll kind of go over that a little bit, is important for just survival and making sure that they're not getting into that super deep sleep for long periods of time and that they're getting calories all throughout the day. The moro is their way of just keeping them alive. And if we're dampening that, we miss feeding cues, like I was going over. So we don't really see a need to start. Some of it is cultural. There are a lot of cultures that do swaddle, and that's just how they raise their babies, and they will continue to do that, and that's totally fine. Some other when to wean after you discharge from the hospital. A lot of babies with our first, we thought we were doing something wrong because he did not like swaddling. We would try and he would just be so discontent. But I think looking back from what I know now, I bet he had a lot of tension. And I did bring him to a chiropractor, but more opinions would have been better at that point. So after discharging from the hospital, but for sure, if baby is swaddled, we want to do it by 8 weeks because they're growing so much. They're learning so many things. So one of the things that we notice that they learn first is rolling. And if they're swaddled and they roll, risk for suffocation. So just for sure by 8 weeks. And a lot of those reflexes that they're born with are integrating by 8 to 12 weeks. So if we can help baby integrate those reflexes, they'll be huge. So some options for weaning. A lot of families see success actually with cold turkey, just stopping the swaddle. You can do it during the day for daytime naps. Just stop and see how baby sleeps. I think you'll be pleasantly surprised. You can start with arms out, like in the picture, swaddled on the chest, but then arms out. You can, like I was saying, just only overnight if you need kind of more regulated nighttime sleep. And it does not need to be all or nothing. This is not something to scare you into stopping cold turkey if that's not what your family wants, because we need, kind of going back to the perfect storm, we want to decrease stressors, we want to limit stressful environments. So it does not need to be all or nothing. And options for safe sleep, that's the thing. For saying that we need to stop the swaddle or wean from the swaddle, then we panic and we're thinking, how do we get our baby to sleep then? Because that's the only way our baby will sleep. So some things, the safe sleep 7, if some families like to bed share, and that goes based off of the safe sleep 7, where parents are sober, no cigarettes, alcohol, medication, firm mattress, no blankets or pillows, no swaddling is in the safe sleep 7, and that is from La Leche League. And I can send more information if you want me to about that. Bassinet in the room, the American Academy of Pediatrics just updated their guidelines for safe infant sleep. They just updated that, I think it was like 3 days ago. And they do recommend for the first 6 months to have baby in the parent's room in a bassinet. If you don't have a bassinet, making a sidecar sleeper like this one in the picture is super beneficial. Baby has their own sleeping environment. You have your own sleeping environment, but they're right there for you. And if we need to improve overnight sleep, we recommend first and foremost more movement during the day and more feeding during the day, whether that's breast milk, formula, or if they're starting solids. So just more food during the day, more movement. Kind of goes for us adults as well. More movement, more activity, more exercise. We're usually more sleepy at night, and we usually sleep better. And again, the American Academy of Pediatrics just updated their sleep guidelines, and they do actually recommend against using swaddles altogether, which is very interesting. So, a little bit about safe sleep. Again, give yourself grace. Babies are learning so much. Their brain grows tremendously in the first year, that they're just gaining all these skills. They're picking up on social cues. Their bodies are growing so much. So give yourself grace. There are growth spurts. Sleep is not a linear thing. We hear all the time, like, my baby slept through the night at 3 weeks old and slept through the night the whole time. Well, sometimes that's not the case, and that's totally okay. It's not saying that you're doing anything wrong. So, importance of movement for babies. Again, integrates reflexes. Those reflexes that they're born with, they need to grow out of. And that's just a normal thing for humans because they're born with these primitive or feeding reflexes that keep them alive. And as they grow, they use their brainstem more, so they don't need to rely on those reflexes as much. Body mapping is a super interesting concept to me. So body mapping is, even as adults, we continue to learn it. It's muscle memory and using the brain. So we use like cross body activities. If baby's on the floor, I'll do it here. Baby's on the floor, we're touching opposite hands to toes. And we see this all the time. We see parents doing that, even without thinking it. It's just kind of in our instincts. So we're just using both hemispheres of the brain. And then we can do some stuff on the tummy as well, kind of do cross body movement, a little massage. So body mapping just helps them understand where they are. Like I said, they're growing so much, so they want that input to understand where their toes are, where their hands can go. where their tongue can go and what their tongue can do. Again, muscle tone. So we need pretty good muscle tone for babies because they're learning to sit up, they're learning to crawl, they're learning all these things. What are some things that you've noticed he's learning so far?
He tries to hold his both fingers and grab
Yeah.
objects.
Yeah. Holding things, realizing that these are his hands. Yeah.
Yesterday I was trying to keep his hand on my mouth.
Yes. Yeah. Exactly. And again, movement can release tension. We see a lot of times if we give baby the opportunity to have just free movement and they have tension in their neck, with the help of chiropractic body work, we see baby kind of release that tension on their own and kind of get their spine. They work on it because it's not sometimes just a magic moment, but working on it, getting that range of motion, understanding that they have that range of motion, and that's where chiropractic can help a lot too. Again, improves gut motility. Again, if we as adults exercise and have regular movement during the day, usually our GI system moves better and supports the immune system. So all of these things kind of go along with importance of movement and not being stuck in a swaddle in flexion for a majority of the day. So some things you can do. Tummy time is great. It is recommended by the AAP as well to do it daily, multiple times a day. And that doesn't have to be long burst or any daunting time frame. Even if it's short time frames, we like to say frequency is better than duration. So let's say you need to go fill up your glass of water, put baby on a safe spot on the floor. Older sister can play with him and show her his toys, all those things. We do tummy time on the floor. Baby will work on his range of motion with his neck, his arms, plant his feet on the ground, get ready for crawling, and just kind of learn all these things that he can do. Again, those cross body movements. We can do some massage, touch his knees, opposite hand, opposite knee. We like to do rolling on the floor. So like if he's in tummy time, we'll roll 3 times one way and then back the other way. What that does is just loosens up his body. Massage is great. Chiropractic goes along with that. Just make sure that his body is nice and loose, in line. And then easiest thing, he has an older sister, involve the siblings. They can sing songs, show toys, show baby how to do tummy time, show him how to move his head, how to move his arms, and then you guys can do something else. And then I just have some funny pictures. So you're doing great. No matter what, you're great parents, and babies are their own person. They will essentially do their thing, and we will honor that. But just informed way of improving sleep, improving movement, and knowing that movement is super important for baby development and us as humans in general. I'll pass it back to Dr. Samuel. Yes.
So, right now he's taking pen play.
Yeah.
I'm not sure being 1.5 months.
Yeah.
But his needs like 7 to 8 hours. But
Yeah.
hand covers, like covers,
Yeah.
like this.
Mm-hmm.
So he sleeps 7 to 8 hours a night. Morning,
Yeah.
I feed 3 hours every.
Yeah. Overnight you
Like,
feed him?
No, no.
Okay.
Overnight he sleeps 7 to 8
Just sleeps.
hours.
Yeah.
Yeah. From since his
Yeah.
So during daytime he sleeps every 2 hours. He feeds every 2 hours.
I
Yep.
feed
Mm-hmm.
every 2 to 3 hours.
Yeah. Yeah.
But nowadays he's having only one.
At a time. Mm-hmm.
Is that okay?
Is he pooping daily? No.
When I checked the doctor,
Okay.
it is okay.
That's huge. Yeah.
I mean, if the baby
Mm-hmm.
not formula or pump.
Mm-hmm.
He is twice a week.
Okay. So skipping some days. Mm-hmm.
I like 5 to 7 days.
Yeah. Which, so if you offer the second breast?
It does.
Do you?
No, he's biting.
Yeah. Distracted. You go in a dark room. I'm assuming you do all the things.
Here, this place, he'll never have. I have to cover him with a scarf like this.
Yeah. Yeah.
That's why I'll avoid going out mostly.
Right. We see this a lot with his age. So he's 4 months.
Going to be 5.
5. So again, they're learning so much. They're looking at so many more things, hearing more things, very distracted. I mean, what we usually recommend is, just keep offering, go in a dark, quiet room. If he takes one breast, usually, I mean, most babies can be fine, just depending on your milk supply. If you have enough in the one breast, then usually that's totally fine. Since he's not stooling daily, that is kind of an indicator that we would like to increase his intake a little bit. But every 2 to 3 hours during the day, especially that 2-hour mark, he's sleeping all through the night. You can definitely try offering more so. One breast at a time usually is fine. If you
after half an hour,
mm-hmm.
is that okay?
Yeah.
Is that gap okay?
Yes.
Or should I wait for 3 hours?
I would go based off of his cues. Yeah. If you do the one side, wait a little bit, maybe he needs to get some movement in. Yeah. Yeah. If his weight gain is fine, is good, then that's our second biggest.
And his content
first.
is not fast.
Yeah. Maybe he's probably going through a growth spurt and learning so many things that he'll probably just all of a sudden be feeding all the time in like 2 days. Yeah. Yeah. So it's not like hard or anything. Yeah. So yeah, I would keep doing that. If you feed him 2 hours and then wait, see if he wants the other side. And even if he takes a little bit from that side, he's getting to the age too where he's getting really efficient at milk removal. And yeah, I would go off of his cues. If his weight gain kind of starts to taper off a little bit, then probably we'll look at other things. But I can give you my card too. So if you have any questions, I can do telehealth or anything. So
He gains around like 2 ounces.
he gains 2 ounces.
Yeah, 2 ounces and like
1 pound or 2 ounces.
2 ounces.
2 ounces. Okay.
16
Oh, okay.
16
0.2.
ounces on our
Actually,
Okay.
0.4 he does, but he stopped this month.
Yeah. So
16.8 last checkup. 16.2 last checkup, and he's been 16.8. Actually,
Okay.
it should be 17.2.
mm-hmm.
But still 16.8.
Yeah, I would
0.2.
go off of your instincts. I would recommend, offering as much as you want. If he feels like he needs a lot of more movement, also, and just kind of more input, you can baby wear him in a carrier and offer that way too.
Morning I'll set him free.
Yeah.
I do massage.
Yeah. I think monitor his weight for sure, and if we need to increase intake, then that's
check his weight every week.
that's perfect.
Previously he was gaining
Mm-hmm.
every week.
Okay.
But now down to
Yeah. Definitely try. Even if you wanted to, sometimes we do around like 2 a.m. You can dream feed. You can feed him while he's sleeping and see if that helps anything. Because babies can still feed when they're sleeping. And we see a lot of great success with that also.
And when do we start solid?
So usually I would say chat with your pediatrician. The World Health Organization recommends around 6 months, but what we look for are signs of readiness. So if he can sit up on his own, if he doesn't just push food out of his mouth with his tongue, that's called a tongue thrust reflex. So we just look for signs of readiness, but usually around like 6-ish months.
his pumping late.
Mm-hmm. As long as weight
I
gain
wait
is
for
fine.
some time if he's on tummy time or
Yeah.
on his back.
Mm-hmm.
Later,
Yeah, usually it's pretty fine. Sometimes babies, they're a little floppy in their esophagus. So if they're moved around, they have to burp, they just kind of all comes up. Usually it's pretty fine.
he doesn't have to, but
Mhm.
he's biting with gum sometimes.
Yeah.
If I allow for the second. Is there anything
For biting, usually what usually helps is if you just kind of stop, say no, and then resume once he's a little more settled. You can even try adding in some movement, some massage, kind of calm his nervous system, and then try again. But yeah.
also not excessive?
Mm-hmm.
Just saying no.
Yep. Yep. We don't want to be alarming. Just kind of calm. That's it. Yeah.
He's not excessively doing that.
Uh-huh.
He's saying no, I guess.
Yeah.
For the second one. Like until I don't.
Yeah. So I think we can trust him when he is full at this point, but we do want to keep an eye on his weight if we notice any continual kind of plateauing.
So for the second one, I'm waiting for some time.
Mhm.
And I'm trying
Mm-hmm.
almost 45 to 50 minutes. Like
Yeah.
burping and giving. Or should I do like that? Or should I, as soon as he's done with the first one and if I offer, you say like no,
Mhm.
shall I give him?
Can do some tummy time.
Yeah.
Yeah. Let
Right,
him
and
kind
then
of
come.
work things out and then offer the second. Yeah.
Is that okay?
Mm-hmm. Yeah. I think that's a great idea.
And question. So, can I dye my hair?
Mm.
With a no ammonium product?
Usually a small amount is fine. Usually. It's kind of up to you,
Is that
really.
no ammonia?
Yeah. Again, kind of really up to you. We usually the less chemicals, the better. But kind of your values and what you want.
I'm asking like, is it okay or is it toxic? There's toxic chemicals into my bloodstream and then to the breast milk. I was reading article. Somebody saying no ammonia product.
Mhm.
There is no evidences. We are from India.
Mhm.
The Indian website says no until
Right.
weaned to solid.
Yeah. Mhm.
Other article says no, there is no significant amount.
I know that's what is difficult
So I was, like,
with
confused.
evidence, right? So, kind of from the mom perspective, you can weigh the risks and benefits. Yes, the chemicals in hair dye have been found to be harmful, right? You can probably, just for us in general, I can see if I can find any articles for you, if I can grab your email after. But it's really kind of as the mom perspective to weigh the risks and benefits for you. But I mean, a generalized statement is less chemicals, even in the presentation, less chemicals, the better for you and him. But as far as breast milk, I can try to find some articles if there are for sure any and share them with you if I get your email after. Yes. Oh, yeah.
All right, so I'm just going to wrap up here. Great questions, and thank you for asking. It's always great to have the feedback and interaction there. So this last part here is just kind of wrapping up last two slides. Our kids don't do as we say, they do as we do. So there's a lot to be said about that. So setting a good example for them is one of the best ways to teach them rather than just tell them how to live and what to do. Model good health for your kids, and they'll know exactly how to go out and get it for themselves, and their children will as well. So you're passing it on. It's kind of a lineage thing, or setting off just what you want for your kids and your grandkids as well. And action steps, as far as if you're interested in what we do there, you'll get contact information for Kirsten and Oasis lactation consultants. But also get a new or additional guide if needed. So that's like the first three. If you want to look into like a lactation consultant or possibly a chiropractor or other, that's also an option, assuming you have some level of medical Western medicine practitioner. And then follow the 7 steps outlined here consistently, but not perfectly. That's the thing. Just small changes, and small sustainable changes are the best ones. You don't have to do it all, just like swaddling. You have to do it all at once. Just do something and keep something moving forward. That's the most important thing, most consistent. And the third thing is, if your family has not been scanned or not under care, we'd recommend getting them scanned. And by scan, what we're talking about is that's what these pictures are. We use state-of-the-art nerve scanning to be able to see how well or not well the brain is communicating with the body. So it's non-invasive, it's not painful. Just looking at the muscle balance, inflammation balance, and also the rhythm of the heartbeat can tell us a lot about whether that person is healthy and really adapting well, or they're struggling. And it goes far beyond symptoms or what you could even tell us as an adult, because kids can't tell us anything symptom-wise. But it's important even for adults, really important, to go beyond what you can feel symptomatically and test and see how well you're doing. Very key point that we talk about in the office is, there's a chart in the other wall there. 3% of your brain carries pain signals. It's only 3% of all your nerve fibers and pathways carry pain signals. So whether you're in pain or not in pain is not a good indicator of health. We got to look deeper, and that's what those scans do. They look deeper into the nervous system to see how well things are communicating. And if any of you would like to go ahead and do that, we have a promotion for the workshops that we do. Several $100s to typically go through and submit that to insurance or pay out of pocket for that. But for the workshop, it's $49 for the first family member, and then half that, $25 for additional family members. If you want to go through, get yourself checked, and then just get a report on your health and see where you're at and what we can do to possibly help you. So, yes, yeah, all ages. We can do the thermography is just infrared thermography, a lot like the forehead scanner, but it's both sides of the spinal cord, and we go from the bottom to the top. So even a baby, if they're wiggling around, we have a way we can still do that and take that temperature reading. The muscle scan, that one, you gotta sit still. Moving all around, it means nothing because muscles are changing and firing. And then the heart rate variability, that's also like when you're sitting still enough. But we do have some level of scanning and testing we can do for all ages. Yeah. Hello. All right. Well, that's it for. So that's where it's tricky with those scans. I've never seen those covered by insurance, and so that's where if we try, you don't know until you try the first time, and you might get hit. So the whole testing, going through all that's $49 for the first time member, and then $25 if anybody else wants to get all the scans and then also the report of what I found. So we prefer just to do a cash promotion right away, and part of that will be checking your insurance and then letting you know if there's contribution and if they're going to help at all. It's just risky to send that out as an initial bill, and they might come back and say you need to prove medical necessity. Okay, you pay all $300 or all $500. Then that's not a good way to start a relationship with anybody. So it's much safer to just do like a cash promotion like that, which would oftentimes be cheaper than a copay or a deductible to begin with. what we prefer to do. Yeah, great question. But always that's what we have for today. If you have any other questions, we'd be happy to show you what those look like. Make sure you get contact information from Kirsten. And yeah.
Solid food.
Okay.
So is that good for the baby?
You said solid foods or the
Solid.
The free,
Okay.
like processed food from the.
Yeah. So in our office,
Organic.
yeah. So organic is great because otherwise you don't know where it's coming from. You don't know if it's been pesticides put on it. That's why everything in the products we have here are all organic. As far as that goes, it's a lot of it's looking at the label. And I can't speak for every single one, but you want to be a little bit of a detective. Look at the label and read it there. If you ever see, and this goes for kids and for you, if you see sugar as an added ingredient, they're putting sugar in because it's cheaper to put sugar in than real food. And that's across the board, right? So a lot of times they're adding cane sugar or corn syrup or something like that because it's, yeah, there you go. Yep. So applesauce, that's even a tricky one. Like try to find applesauce that's just apples, not high fructose corn syrup and then a bunch of apples because it's, yeah, it tastes, yeah,
When we
it
go
does.
shopping, like I saw the label and then say what is the ingredients.
Because
Yeah.
nowadays she is very much interested in sweet.
Yeah. But there's also, it's called your bliss point. So your body, just like anything, if you go work out a lot, you're gonna get stronger, but your taste buds adapt. It's called your bliss point. So if you get used to eating things that aren't as sweet, you become more and more satisfied with them. And then you go to eat something sweet and it's like disgusting. So it's like kind of like if you gave up pop for like a year and never had any soda or anything, and then you drank one, it'd kind of be like, oh, this is just too much for me, kind of overload. So that's something that we've been really careful with our kids. We try to, I mean, they're coming off of breast milk. It's the only thing they've ever known. So we got to try to be careful about when we want to introduce fruits and sweets and things like that because they don't know anything different at first. Food's fun or it's just interesting. So,
She's very much interested.
okay. So,
Once we eat.
yeah. And they kind of just eat what we eat. So, like, once again, they're eating what we eat. But as a general rule, even for like Amy and I, as adults eating a dinner, we like a meat and a vegetable. And then the fruit is often like after that, presented after, or even as like a dessert. So like fill up on the meats and the vegetables, and then if you want something sweet afterwards, the fruit can be dessert. But to have fruit be like one of the third, you're filling up on that, the kids are gonna go right for the fruit, and then they'll have a hard time eating anything else. And you can't blame them because they want more of what's sweet, and that's just their brain lights up when they eat that fruit, and it's not as exciting to eat that chicken or the peas or whatever it is. And then on vegetables, vegetables like most people like popcorn as adults, and that's just corn isn't a vegetable, but it's like a vegetable type of starch slathered in an oil with salt on it. Peas and like sweet corn and carrots and all of that, as long as you don't overcook them and they're not mushy and nasty, you can add some healthy butter or coconut oil to them and then let them add some salt. It's a very similar taste profile and flavor, and it can be good. But yeah, I don't really prefer to eat just plain vegetables with nothing on them, but they're delicious with some oil and some salt on them. So that's been really helpful for our girls too. But to answer your question, as far as like Gerber food, it's like just reading the label. A lot of that stuff is designed to sell. It's designed to be profit margin. And we've never even gotten the habit of that. Like we just kind of mash up what you're eating. If you have a sweet potato, mash it up and let them, sometimes it can be convenient. Yeah. Yep.
Give them like a spoon.
To play with. Yep.
Feeling that.
Okay.
When we were traveling.
Yeah. Traveling can be, yeah. So like when they're first starting to eat, I mean, then there's some cheaper options like Cheerios. We'll do Cheerios because they're not like sweet. Not that they're great for you, but they're just like they tiny bit. They're not like sweets. They're not getting hooked on it. I actually prefer like once they're old enough and they can have some teeth, just like the plain rice cakes. And you gotta watch them. You don't want them to be biting off too big of a chunk, but that can be a great just a popped rice. Little, and it's just salt and white. So we do that, or even like if you can find some like the natural non-sweetened cereals and puffs, or you can pay more if you buy like the grain-free puffs and different things like that. So for traveling, yes, it's super handy. But once you get kind of a feel for what they like, you can just bring some of your normal foods and snacks and applesauce. But yeah, they are. Yeah, the puree packets.
It's
Yeah.
hard because sometimes they tend to be like fruits and vegetables combined. So it's nice to find the packets that are like, just the veggies.
Yeah.
So that they're not used to, I like my
sugary
seeds,
ones.
but only if there's apples.
Yeah, just keep in mind, like everything out there, the packets, they're all designed to sell and get kids to eat it. So they're gonna put fruit with the vegetable, or fruit with the vegetable, or sugar with the vegetable. Just kind of be on the lookout for that. But that's kind of like the basic guide.
Most of the things that went through the slides, like
Yeah.
we follow like for fevers, we don't give
Great.
like food.
Great.
They either like give the patch or like
Like a cool rag.
and then
Yeah.
prepare some soup and keep
Yeah.
them hydrated.
Yeah. Yep. Soup, because that has so much of the salt in it and the things they need, and
And
often
I
they
had
like
like
it.
poor memory, like I forgot things and then search for hours and hours. So I read like so many books why I'm doing that. And
Yeah.
I'm fascinated about the brain and the nervous system.
Yeah.
Like 3-4 books about it.
Yeah.
Accelerated learning and how to remember things.
Yes. Yep.
So most
Yeah.
of the things I can just
And there's a lot of
learn.
yeah. I've looked into that a lot myself, just different learning strategies and how you can learn better. And it's pretty fascinating with these learning competitions. These like they try to like whoever can memorize the order of a deck of cards fastest. Like it's pretty fascinating what you can do to build
Recently,
tricks.
like I'm learning about the guts because she finds it very difficult. Like she constipated like when she's pooping.
Okay. You said she's constipated?
Yeah.
Okay. Yeah, and that's often like that. They're eating a lot of different foods, but sometimes their spine is changing so much. And how many times has she fallen on her bottom learning to walk? And so, if that part of the spine, for example, gets dislodged, that can be a reason why just the whole lower part of digestion doesn't work. And then pooping becomes painful, and then they don't want to, and then they become, scared to do it because it hurt last time. And so all these things can be just compounded on top of each other, just because of like a fall on her bottom. So that's where it's like it's so insightful to be able to see and have a scan and see if there's something going on there, or what could be done to help and get that okay.
Yeah. Like the concussion test sometimes they talk about, right? When do actually sometimes they have like a heart fall.
A hot
like,
what?
Heart fall.
Oh, heart fall. Yeah. Yeah.
I don't know like when I should actually go for a consultation.
Yes.
Because
okay.
they run and they fall almost all
yeah.
the time.
Yep.
Like sometimes they're bad, sometimes they're okay.
Yeah, so concussions are tricky, and there's not a very clear diagnosis criteria for them, and that's what makes them so tricky. So it doesn't necessarily mean like you had to like lose consciousness or even had to hit your head. Like there can be a concussion just from the whiplash aspect of it. Now kids are shorter than adults, so when they fall less hard. 6 feet down is different than 3 feet down. But it's a tricky one. Like if you like, helmets are a must, I think, when you're doing bikes and things like that. But a lot of the natural like bonks, and you kind of look at how they respond too. If they bonk their head and they cried for 30 seconds and they're fine, wouldn't be too concerned about it. But if you see them really like hit their head hard, if there is a loss of consciousness, I would always go get that checked out. If there's anything with like they throw up, if they see a black eye, if they got hit in their head and there's a black eye coming in, go get it checked out. It's kind of a tricky. You gotta tease it out because you don't want to run in every time they bump their head. And that's not necessary.
Yeah, that's the
but
thing. Like I watched like so many episodes of VR and things.
yeah.
They like usually like ask question whether they throw up, if they throw up like how many times in
Yes.
24 hours. So I don't know whether we have to wait until that time. I keep questioning like our memories from the past. So
Yes.
a
lot of that's
most sports that I watch, cricket, the first thing they get hit by a ball, they ask a series of questions.
That's
Sometimes
important.
If you fail, like that's when they take off.
Yeah.
I question her. Like,
Yeah, that's good. Easier to do an adult. Not sure if you're getting a straight answer from a 5-year-old, so that's a little tricky. But yeah, that's kind of like it's a judgment call. I guess if in doubt, go get checked out. But it's not. I wish it was clear the criteria, because that doesn't even have to be like bleeding in the brain visible or for a concussion to happen, and it's tricky. But a lot of times, okay, so even if there is a concussion, the protocol for healing is just be making sure they're not excessively sleepy. You might want to wake them up that first night to make sure that they're still coherent and things. But then the body heals. There's not like an intervention that has to be had after a concussion, unless there is like a brain bleed or like a skull fracture, which is a major, hit your hip really hard to have that happen. Other than that, it's called a sensory diet. Like for the next couple of days, you give your brain a rest. You limit screens, you limit thinking and stimulus, and that's the best thing to do after And then kind of everything we talked about there. I mean, just better food, less sugar, get adjusted, like all that stuff is super helpful with any injury, but especially head, brain injuries like that. But that's a great question.
Yeah, that's a thing that I just don't have an answer.
Yeah, that's the best answer I can give you too. I've had, I mean, yeah, yeah.
So some of my friends, like, it's even for the certain things they just run to here.
Yeah, because that,
They're
yeah,
not going to do anything.
it's expensive and not necessary, and yeah.
Right.
But those are some things to watch out.